Very good evening to all the mommies. Stay with us. We are just waiting for our expert to join soon. There he is. A very good evening, sir. All good?
Very good evening.
So I think the video is clear, the voice is clear. Let's start our evening for today. Hello,
Can you?
mommies. A very good evening to everyone. Thank you for all your support and love that you have given us from last 6 days as we are with our 7-day series in the International Breastfeeding Week, and today is the last day. So as I promised, we will be getting experts from all different fields. So far we have met our gynecologists, we have met IVF doctors, we have met lactation consultants, and we have also met nutritionists. So today, to introduce our next expert, we have with us a neonatologist, a pediatrician. His area of expertise includes pediatric critical care and intensive care and neonatal intensive care. He holds fellowship in neonatal and perinatal medicines from Australia and Canada. He has his expertise in managing high-risk babies. So far, he has managed more than 1,500 high-risk babies with a survival rate of neonatal ICU 98.2%. Some of his unique skills is expertise in managing small babies. So he has successfully managed smallest weighing baby of 450 grams and 530 grams. He has also successfully discharged 4 quintuplet premature babies, which is a national record. Also, he has expertise in organ transplant like kidney, liver, heart, lungs, and gut. A very warm welcome to our today's expert, Mr. Vinay Joshi from Mumbai.
Thank you very much. Thanks for
Thank you so
the.
much, sir. So moving on, sir, I would really like you to I will request you to share with us that what motivated you to be a pediatrician.
See, my long story. My uh, electricity board. He always came with the people for that.
Sir, the voice is not coming
Yeah.
clear.
I just wanted to be in the like if I can come and work for the people, that was always a motivation. So and that time it was either civil services or the doctor. These are the two professions where you can be direct in contact with people and you can work for the people. So I decided to go for the medical profession, and I always loved kids. As I was doing my initial graduation, I think is working with the kids is wonderful. They keep you young at the same time, and they can't express their emotion. They can't express their, what do you say, the pain, what they're going through. So it is a big challenge, when a child comes to you. Unlike adults can tell, what is happening. So
Mm-hmm.
that way, that's the thrill, and that's why I chose pediatrics as my specialty.
And as we all know, the neonatalist field and the ICU and everything. So, what keeps you motivated in those crucial situations?
Well, I think smile when a child comes to you when very sick. You don't treat just a child; you treat entire family. Okay, so while taking care of a child, you have to support the family. You need to keep talking to them. You have to motivate them. You have to keep their morals high. And when you are doing all these things, once the child gets better, goes through that critical phase, starts recovering, and at the time when we discharge the child from the ICU, the kind of the happiness you give to the family, the smile on their faces, the smile on the child's face, that's it. You can't compare it with anything. You can't trade with that with anything else in the world. So I think that is what keeps us motivating. We come across many times, a few times, setbacks. We go through that bad patch as well, those emotions. But I think the majority of the times, when the child goes home, it gives us an immense satisfaction.
So, sir, so far, what is the most difficult experience you had in like around 20-24 years, right?
Yeah, 20, yeah, almost 20, 25 years, correct. See, the most difficult part in the sense, rather, I would say the challenging part when you're practicing medicine, especially the intensive care. And you already mentioned in the introduction that in those quintuplets when they're born. I see we had just come back from the training in Australia and Canada, and we were just setting up our ICU in Coquitlam Hospital, and that's where these babies were born. Quintuplets, I had attended twins, we had attended triplets, but never quintuplets. And that too at 28, 29 weeks of gestation. Can you imagine that? And they're so small. The biggest baby, probably, I think, 920 grams out of that expected weight. And all the babies were weighing between 800 to 900 grams total. And the five babies, I know we had to, what do you say, we have to do the drills before we go and attend the delivery. We had to talk to the families. We had to create 5 teams to receive the babies.
Right.
We 2 senior doctors. Then we had got the 3, 4 junior doctors. Getting them, practicing them how to go, everything. So we drilled before it all happened, the mock drills, and then we went to attend the delivery, and it was a tense moment. 5 babies coming in within 5 minutes out. They were very small. We have to take care of their breathing because they couldn't breathe properly as they were very small. So we have to give the support. We have to take care of their temperature and so many things. So whatever we call it as a neonatal resuscitation. So we have to do at 5 places. 5 incubators we have to keep ready. 5 sets of nurses were ready. So you can imagine, kind of it was that I can't express, I can't put that experience in words, but it was the most challenging situation I have faced, in my career so far.
I can understand because when we deliver one, there are already 6, 7 people around. So delivering
Absolutely.
5 and with different teams, it must be very difficult for even doctors and even for the mother.
Correct.
Yes. So how was the experience with delivering like 500 and 600 gram of baby? How to hold the baby and how was that experience?
See, it's always surreal, when you go and talk to those parents, you start, before, when you anticipate that this baby is going to be very small, born so early, you start talking to the parents, explaining to them, how, what are the challenges in the baby's face, what are the challenges they are going to face, and as a doctors, what we are going to do, and we tell all those things. But still, when the child comes out, still we stabilize the baby. It's very, very. These are the crucial moments. We call them, golden hour of treatment or platinum minutes of the initial, birth. They're very crucial, and once we start, we feel really good, and then it's a journey starts. That's the real journey starts, and then the baby spends around 2 to 3 months in the ICU, and it's never I would say it's a smooth ride. It's a roller coaster ride, ups and downs. I always tell parents that, okay, it's just not you going through. We as a family will go through it. I'm with you always. Whatever happens, you'll be the first person to know, people to know what is happening to the baby, and I think we'll cross this bridge together, all of us. And it's a journey, and it's a tough journey. But as I said, when this baby goes home, I think the kind of joy, the kind of satisfaction we get is, unmatched.
So, with all your expertise and the experience that you have in your life with the kids, definitely the topic which we picked up, it suits this thing. So, today we are going to talk all about preemie parents and breastfeeding preparations. So, before we start the parent part, so why don't you tell us what is prematurity and how those babies are different from the term babies?
See, if I put it in simple words, baby who is born before completion of 9 months.
Okay.
When I say 9 months, it is like 37 weeks. So any baby who is born before 37 weeks or 9 months completed is the preterm baby. Okay, now then you can, there are, if the baby is born too early, then we call it as, extreme preterm, very early preterm, then early preterm, late preterm, like that, depending upon, how early the baby is born. But baby who's born less than 37 weeks is the preterm by definition. Now, as the baby has not completed 9 months in the womb, so baby has come out early. So there is going to be a difference from the term baby who has completed 37 weeks or 9 months. These babies are smaller in size, they are smaller in weight, and not only that, their organ systems are also not matured like a normal baby. So head to toe, if you take, the maturity of the organ systems are less, and that's why what happens, all the whatever the troubles the babies go through or whatever the complications can happen, it is because of that. And that's why, some of the babies who are very small are born too early. They have to go to the neonatal intensive care unit. They die instead of going to the mother.
So, what causes premature delivery?
Well, I think in the current era, maybe our lifestyle, the lifestyle change, I think it's one of the important factor. But at the same time, if the mother is too young, or the elderly mother, then there are chances of prematurity. If mother has any medical condition, sometimes diabetes, or the mother has hypertension or any other chronic disease, or the chronic condition, that can lead to prematurity. Multiple pregnancies like the twins, triplets, quadruplets, they can lead to preterm labor. The mother can go into preterm labor. Infections like, sometimes urinary tract infection or infection in the mother can lead to prematurity. So there are many factors, which can predispose mother to go into preterm labor. Suppose the mother had, previous child born at preterm gestation, there is likelihood that, this pregnancy as well, she may go into preterm labor. So I think these are the few conditions, where you need to be careful. She may have preterm baby.
So, lifestyle plays a big role in everything.
Absolutely, yeah.
So, what are the challenges that a preterm baby faces once the baby is born and later in the life?
See, as already mentioned, they're not only smaller in size and weight. Their organ systems are not mature. So the most important thing for that matter is the lungs. If they're too early, so they can't breathe like normal baby, and they can't maintain the oxygen levels in the blood because just the lungs are not mature enough to function. So in that case, we have to support them. We have to give them the breathing support on the breathing machine,
Right.
like that, and they're breathing this support maybe for few days to few weeks sometimes. Okay, similarly, like the heart, if is immature, then the heart, we have to support the heart system as well. The gut, they can't feed properly, so we have to take care of the nutrition also in different way.
Right.
Like the immune system is very weak, so they need sometimes support with the antibiotics. So these are the few major issues they come across, and as I said, all the organ systems are immature, and we have to support them accordingly, as and when need comes. Okay, so they require. That's why they require the ICU care, what we call the neonatal intensive care unit. For some time. Few babies require for a few days. Sometimes the babies spend a few weeks in the ICU for that matter.
So, even after they are discharged from the ICU later in life, like a baby is 3 year or 4 year, still there will be a difference from a normal term baby to a preterm baby in their growth and other things.
Absolutely. So they do catch up with the term babies in terms of their physical characteristics, like say the weight, their head size. Okay, so these are the parameters, the length. So they catch up over a period of time. So it takes 2 to 3 years for that. So then but till then, till that time they are lagging behind. So we call it as a catch-up growth. So that catch-up growth happens, next 2 to 3 years. Then you can't make up the difference between the preterm and term. But having said that, being born so early, and many times if they have gone through stormy ICU course, then they can have they are prone for infections a little bit more as compared to the term baby. Okay, so some of those things we have to keep that in mind.
So, sir, do premature babies also cry at birth? So, the moment they are out, do they cry like a normal baby?
Yes, they do cry. They do cry. Yeah, sometimes the cry may be weaker. It is not a robust cry what we hear, the hearty cry. What we hear when the term baby, the big baby is born. They do cry, but if the baby is too small, okay, they're too young. Say instead of 37 weeks, what we got normal, if the baby is 24, 25 weeks. Okay, so in that case, the cry may be weak. Now, let me tell you something. What does the cry means basically? When the babies cry, their lungs open up.
Right.
Their lungs open up. So the very vigorous cry, the very loud cry, it means the lungs are opened up properly.
Okay.
Okay. The term babies can do that. But if the baby is too small, the lungs are so weak. So that's why they can't cry. And then the lungs remain weak. The lungs don't open up nicely. And that's where they require the assistance from us. Okay. So the smaller babies, they don't cry sometimes if they're born too early. But yes, the preterm babies do cry.
So, what is the difference between the preterm and premature? Both are same.
They are the same basically. Like the preterm in the way it talks in terms of the gestation period. Okay, it talks about the timeline. Okay, so that's what the preterm. What about prematurity means? Prematurity means it talks about the development of the organ systems. Premature, premature lungs, premature heart, like that. Okay, it basically talks about the maturation of the organ systems in the baby, and preterm talks about the timeline. So basically, both are same. That's why we use it interchangeably. Preterm baby or premature baby, like that.
So, moving on. So, what is kangaroo mother care? And what role does it play in preemie babies?
Okay, now see that it's a story. It's a nice, interesting story. How it came into practice in the first place. So this was started in Colombia, in Bogota. The neurologists, when they were looking at, what they realized, when you look at the kangaroo,
Right.
the baby is born, it's so small. It's like a peanut. It's pretty small, few
Okay.
grams. But what happens that kangaroo, the mother keeps that baby in the pouch. So
Right.
there is a pouch, and the baby grows in that pouch till it becomes independent. Okay.
Okay.
The same concept we use in kangaroo mother care, especially for the preterm babies. So here we do the same thing. So when we say kangaroo mother care in the ICU, we keep the baby and the mother together, and they are kept in. There is a skin to skin contact. So the
Right.
baby is kept on the mother's chest between the breasts, head turned to one side so that the baby can breathe nicely, and basically ensure that there is a skin to skin contact between the baby and mother.
Okay.
Being like that, mother gives warmth to the baby. So the baby can maintain the temperature well, better than even the incubator where the baby is placed. Yes, and there's more advantage to the baby, to the baby as well. The baby grows better here. The baby gets less infections. Baby learns to suck. The breastfeeding also becomes faster. Okay, gains weight, and the baby can be discharged home early. And if, from the mother's point of view, when you give kangaroo mother care, the mother feels empowered. She feels confident. She feels confident that the baby is getting better.
Right.
Stimulus for lactation. So the breast milk production increases. She's more happy. She's more confident to look after the baby,
Right.
and helps in the breast attachment. So when you say kangaroo mother care, it's just not the skin to skin contact. So there are what we ensure that along with the skin to skin contact, we give exclusive breastfeeding, or you use exclusive the express breast milk all the time. We don't use any. Make sure that if the child goes, even when the child goes home, child receives kangaroo mother care, even at home. And sometimes, if for some reason, if he can't give mother can't give this, even the father can do this.
Oh,
So or
that's
the KFC, sort of the kangaroo father care. Okay, but anybody who can from the family who is comfortable can do this care.
definite. There's nothing better than your own, like keeping the baby just close to you and giving that warmth to the baby.
Absolutely, absolutely.
So I think there's a mother, she's asking my preterm twin baby from zinc deficiency. So she has infection marks and spots her on hands.
Okay.
How can we help her? So
Then how old is the baby? Depending upon that. So we can use the zinc supplements.
okay.
So, but we need to make sure they are because of the zinc deficiency. Okay, baby can have spots because of various reasons. Baby can have spots because of even the vitamin deficiencies. So preterm babies do have vitamin, they do have mineral deficiencies because most of the minerals, most of the vitamins, most of the nutrients are transferred in the third trimester of
Oh,
pregnancy. So if they're born early, so this transfer doesn't happen. So we have to supplement them.
right.
So they need supplements for that reason. So we need to supplement them with the calcium. We need to supplement them with the vitamin D, even other the multivitamins like A, B, etc., and of course the zinc as well.
So
Okay.
moving on with the evening, uh, as we are now breastfeeding week, I would definitely like to touch the topic breastfeeding. So why breastfeeding is important for preterm and term babies?
I think we have no doubt about the advantages of the breastfeeding that it offers, the breastfeeding offers to the baby, to the mother and to the society as a whole. Okay, and now come with, if you talk about the baby, the most important for the baby, easily available milk, easily digestible milk, and it is rich, densely rich in calories and proteins, minerals, vitamins, etc. So basically, it's a complete food. It's a complete sterile food, easily available, okay, easily digestible for the baby. So this is the biggest advantage of breastfeeding. Now there are many other advantages, like it gives the component, the proteins, fat, they're easily digestible and easily absorbable. So that is very important. They are in sufficient quantity and the quality as well. Okay, so you don't have to supplement, if the baby is on breastfeeding with any other thing.
Definitely.
Then it gives, offers anti-infective properties. Like it has got antibodies in that, it has got immunoglobulins in that. There are other protective factors in the milk which prevents babies having infections. And it prevents very serious infections like ear infections like otitis media, pneumonia, the diarrheas. Okay, so it prevents allergies. So babies who are breastfeed, they have less number of allergies, or in the immediate during the childhood as well as in the later part of the life. So they confer so many advantages. So the breastfeeding is definitely good for the baby, and in such a competitive world, the babies who are breastfed exclusively for at least 6 months, they have better IQ points than the babies who are formula fed. And this incentive, I think the mother should keep in mind, and that's why they should go for breastfeeding. So there are lots of advantages to the baby. So, and the baby should be breastfed. All the babies should be breastfed. So 100% breastfeeding should be achieved, especially for countries like India and everywhere for that matter. And even the breastfeeding gives a lot of advantages to the mother as well. Like, it gives a lot of confidence to the mother. Mother does it. See, they just imagine mother has to wake up, make a formula milk in the middle of the night. So it's so much of hassle. If you have uh, the breast, feeding the child, you don't have to do much. It's easily available. Without even, you don't have to wake up sometimes. You don't have to wake up and sit and give the breastfeed. Lying down position also, you can breastfeed the baby. It's easily available. You can reduce weight. The natural, the loss of weight happens, when the mother is breastfeeding. Even uterus involutes very early. This is, the more scientific term I'm using. And it prevents some cancers as well. So I think it's a lot of advantages to the mother.
Right.
If you look at this year's theme, protect breastfeeding, social responsibility.
Yes.
So that's why when I'm talking, when we are talking, I think I would like to emphasize breastfeeding is just not mother's responsibility.
Absolutely.
It's baby's right, it is a baby's birthright, and it is a responsibility for all of us as a society, the parents, the family, the workplace, management, everybody. This is everybody's responsibility.
So I think there's a mother, she's asking, I have low-lying placenta and breech baby. I'm 36 weeks, 6 days pregnant. My doc told me 37 week we have to plan a C-section. Is it good for the baby? Doctor told blood loss will be heavy even after C.
I think the doc is right, and what he's saying is, if you look at the reasons, I think that is the decision and the best option to deliver the baby. Is it good for the baby? I think there shouldn't be a difference between the baby should. Baby will not be affected by the mode of the delivery. The only things what will happen is, like you have to initiate breastfeeding when the baby is born. So at least once the mother wakes up, once the effect of anesthesia is gone, she should try to breastfeed the baby. So otherwise, I don't think that it won't cause any effect on the baby for that matter.
So, sir, how does having a preemie baby affects the milk supply, and how can a mom maintain a good milk supply even after delivering a premature?
I think it's an excellent question, Nisha. It's really a good question you asked because see, the moment the preterm baby is born, there is a lot of anxiety. A lot of anxiety among the parents, anxiety among the family members, and of course the doctors. The who are treating the baby. But preterm birth itself per se shouldn't affect the milk supply. Okay. Now, but you need to do few things before. And now, so you have to suppose you're anticipating preterm child. Then what do we do? Basically, you try to get information about the breastfeeding before. Okay, you can get this information easily available on the website nowadays, on the magazines, and you conduct the shows like this. Even you are spreading the information about breastfeeding. So I think you should always get the material, try to understand how it goes in the preterm babies. Okay, now talk to your pediatrician, talk to your gynec obstetrician, and ask about the breastfeeding. How she, how they can support her. They can give her information about breastfeeding. So try to gather information. Talk to a lactation consultant. There are lactation experts available. They will help you before and even after the baby is born. Okay. Once the baby is born, the most important thing to establish breastfeeding or the breast milk supply, I will say, start expressing.
Oh,
So
okay.
once the baby is born, once you are stable, recovered, start expressing as soon as possible, if possible within 1 hour.
Okay.
Start expressing milk early, start expressing often, and express it well. So, at least for 15-20 minutes every time and 8 to 10 times in a day.
Right.
So, so when you express milk, it will stimulate the lactation.
Okay.
Okay. Increase the hormones which in the body which help in lactation, in production and the milk supply both, and
Right.
that will maintain the breastfeed milk supply for a long time, even though baby is in the ICU or for some care. So that is very very important. And as I said, if the baby is in the ICU for some reason, for the for the care, see, you can, once you feel better, you can you can visit the baby anytime. Okay, you can go visit the baby if the baby is stable. If the conditions are allowed, you can touch, you can hold the baby's hand. Okay, so the baby is being fed through the tube or something like that. You can watch the baby being fed that time. These are the all small things. Will, what do you say? Definitely help in lactation, in the milk production. Okay, because these are they help in secreting the happy hormones. And those happy hormones and the hormones which help in milk production, they increase, and it will make easier, for the breastfeeding and the breast milk production.
So, what are the options? Like, I read it somewhere that is donor milk safe for the preemie babies if the mother is not able to lactate at all?
Yes, donor milk is safe, but if it is pasteurized and it is properly stored, I think this is very very important. So there are milk banks available, around. There are a couple in Mumbai itself, one in Sion, one in Wadia Hospital. And yes, the donor milk is safe, but as long as I said, it has to be pasteurized, it has to be well stored. One thing, if once bought during pasteurization process, some of the anti-infective properties like antibody levels come down. Some of the active metabolites, they are also reduced in number. So the so-called anti-infective properties little bit less in the pasteurized milk, but otherwise it is as good as mother's milk.
That's really nice. So, what is the importance of colostrum when it comes to a premature baby? As we know that colostrum is very important for any baby, but is does it has a more importance for a premature than a mature baby?
It is important, as you rightly said, it is important for both preterm and term babies, and especially in preterm babies because of its anti-infective properties.
Right.
Okay, and factors, there are growth factors in the colostrum. They help in the growth of the gut as well, the maturation of the gut as well. So that's why it is very, very important. So I to call it as it's like liquid gold.
Right.
Okay,
We always call
as liquid gold, and then you should always ensure, take efforts that all the babies they get colostrum, including the preterm babies especially, because that is very, very important. Many times, you can store that milk. The baby, if you can't feed the preterm baby for some reason in the beginning, so you can express and you can store the colostrum and later can be used. So colostrum is very, very important.
it. Right. So, as you said, to express the milk, so why not to directly feed a premature?
Again, a very, very good question. Not possible to directly breastfeed the preterm baby. As in the beginning of our discussion, I said, their organ systems are not fully developed. They're not
Right.
fully matured. Now, sucking, breastfeeding is a complex process. It's complicated process. And what it requires is, there are three things happen simultaneously. One is sucking and breathing.
Right.
The three important things happen. And there has to be coordination. Comes with time. It comes with the maturation of the nervous system, the maturation of the brain, maturation of the muscles of the oral muscle, oral musculature. So that doesn't happen many times if the baby is very preterm. Okay. It happens gradually, so it starts happening. Swallowing comes quite early in the fetal period. It's
Right.
not a problem. The suckling and breathing simultaneously, and that coordination it happens only between 30 to 34 weeks of gestation. That wait, so we have to wait, and that's why if the baby has not reached that stage yet, it's better to not breastfeed directly. You express and then you feed with either palate or spoon.
So, when can we expect a premature baby to start suckling?
See, the suckling, baby has some sucking movements even while inside the womb. Okay, but around say after that they complete around 8 months, that is 32 weeks, and that's where they start suckling at the breast, the proper suckling. And the coordination, if you ask proper effective sucking and swallowing coordination, that happens only at 34 weeks. So if you want to try breastfeeding the preterm baby, then the baby should be at least close to 34 weeks.
So, after delivering the baby, also we keep counting with the weeks, and the moment they become 34.
Yeah. Oh, you'll be surprised. What we do is, the baby is born at 34 weeks. We look at when the baby completes 40 weeks, that is the expected due date. And when that date we call the baby is born. So that is, till then it is baby still 36 weeks, 37 weeks corrected.
Okay.
Okay. And then we start counting. After 40 weeks, we start counting. So we call it the corrected age. Okay.
Right. So, as you mentioned earlier, also when the babies are preterm, their organs are not properly developed. So, do these preterm babies also have digestive system issues when they grow up?
When they grow up, probably not. But while they're growing up in the ICU, if they're born very preterm, they do have the GI issues. Okay, so now basically, as the gut is also immature, not grown completely, it's the digestive system is not fully operational.
Right.
Okay. Then even the quantity of food, amount of food we give, that is also we have to go slowly. We can't just give the child whole amount of what is required.
Right.
So sometimes what we do is we start very small amount of food, say 1 to 2 ml, to begin with, and that we give every 2 hours, and then we gradually go up, build on that, so that then the baby reaches slowly over a couple of weeks to the full feeds. And it feeds through the NG tube, nasogastric tube. We put a tube which goes through the mouth into the stomach, and we give the tube feeding. That's how. So because the GI system is not ready to suck, swallow, as we mentioned. At the same time, we can't give entire amount, from the beginning. Rather, we have to go upgrade slowly. So go slow and start low like that. That's how we build it up.
So, exclusively breastfeeding is one thing, and breastfeeding only for like breastfeeding for a few months and then mixing it with the formula milk. So, what is the difference between exclusive breastfeeding and non-breastfeeding babies when it comes to health? What are the risks associated?
See, when you are exclusively breastfed, what you are doing, as we already discussed, that it has got a lot of anti-infective properties.
Right.
I think it has got all the nutrients in proper quantity and proper quality. All these are very, very important. Now, that's how the exclusively breastfed babies have advantage over the other babies. When it comes to infection rates, they are definitely less. All the serious infections are significantly reduced. The respiratory tract infections are almost 30% less than the other babies who are fed formula for preparations. And not only that, the allergy conditions don't in the exclusively breastfed infants, while they are increased in formula fed babies. So these are the advantages are already there when you are exclusively breastfed. When you are giving formula feed or intermittent, you are using formula as a supplement, you are losing the advantages of exclusively breastfed baby.
Definitely.
So those you are not going to get. Yeah. But while saying that, for some reason you can't breastfeed the baby or you can't give exclusive breastfeeding, don't give up. Continue breastfeeding and supplement, whenever it is required. But always should be focused on breastfeeding. Breast milk, mother's own milk is the best. This is what I will say.
Completely on your side on this. Like, breast milk is the best, and it's a baby's right to have that thing, not only for the baby but also for the mother's health. It is very important.
Absolutely.
So, sir, there are so many brands now in the market who keeps showing us the formula milk, this, that. And there are a lot of brands who helps to supplement the breastfeeding or to increase the milk supply and to support the breastfeeding. What will be your first choice and why?
First choice, mother's
If
own milk.
mothers have come to you, for the supplements, you will say go for the supplement or continue with that amount of milk that you're having and support with the formula milk, or they should be going for supplements. Those are available in the market.
See, this is holds true for the especially preterm infants. Okay, so many times we do that. The mother's milk, we try to make it rich in calories and proteins.
Right.
So, but like there are human milk fortifiers are there.
Right.
So when we add that to mother's milk, it will increase the density of calories and the proteins. Okay, so is even the calcium and the vitamin D, etc. So that's why we supplement. Sometimes we use even medium chain triglycerides like MCT oil. The oil we add because oil is again dense in calories. Okay, so that way we supplement the calories. So there are ways to do it. So, but one shouldn't use them at their own discretion. I think it has to come from the doctor.
Definitely.
Epidemiologist. You consult, and then only you can add those to the mother's milk.
So I think with all these questions, I'm on the end of the show. Thank you so much, sir, today for giving us your time and for a very important topic. There are so many questions which I collected from last week from so many moms. I'm sure they must have got all the answers. Still, if you all have any questions, please do share in our DM. We will get back to you about that. Thank you so much once again, as we are on the end of our International Breastfeeding Week. Breastfeeding is natural, not like breathing, which is automatic. It is like walking, which needs to be learned.
Absolutely.
So moms, laugh, sing, dance, and glow, and let the oxytocin flow. Breastfeeding is the best choice for your baby. Thank you so much for joining us today. Thank you so much, Dr. Vinay Joshi, for giving us your time and for all the information that you have shared with us today.
Thank you. Thank you very much.
So much, sir.